Hi, Joe here from OPTIMUM Physiotherapy. This video is going to show you a technique that I've developed myself over a lot of years, having seen other methods applied, and it's really to try and take some pressure off the sole of the foot, specifically with people who are suffering with plantar fasciitis. So before we start the taping technique, we're going to ask the patient to come up into dorsiflexion and to try and hold that position. This is also really good for people who have got very flat feet or pronation in the rear foot. So what I'm going to do first, I'm just going to take a little bit of tape and I'm going to ask the patient to stay in that dorsiflex position. But when the tape comes on the heel, I'm going to ask the patient to press downwards towards the floor. So they're pressing and then I'm making a lot more tension coming to the start of the medial and the lateral arches. So that's the first little bit of tape. Patient stays in dorsiflexion. We're just going to repeat what we just did. We're just going to overlap a little bit. Come in a little bit more at the Achilles. Push down, Joanna. Thank you. That just helps to stabilize that talocrural joint a little bit. I'm now going to put one, come in straight down the Achilles and finishing just on the base of the heel. There's no tension needs to be applied by the patient for this one, but I'm just going to press around the Achilles, and it's really to get some coverage on the sole of the foot, because the next little bit of taping is to try and get coverage all through that plantar surface. Okay, so now we're going to tear strips of tape, lay it on the sole of the foot without tension, and then we're going to create a lot of tension coming up medial and laterally. And then we're just going to keep overlapping until we get to the top of the metatarsals, so around about here. So again, just laying on the sole of the foot and then creating as much tension as you can towards the head on the medial and lateral sides. And again, all the while the patient is trying to actively keep that foot in a dorsiflex position. Just going to do one more. Now for some people, this will give them a lot of relief, but they'll say things like, I just need a little bit more tension on the inside here. So you may get them to stand up and see how it feels. And if that's the case, this is what I do. I put the tape in the middle of the foot, just towards the heel, and then I'm going to create a huge amount of tension on the medial arch and just finishing just in front of the medial malleolus. And I may do that 2 or 3 times, just overlapping as we go. So no tension here on the sole, and then we're going to create a big tension on the medial arch. I'll just do one more. And again, no tension here, and then big tension pulling that medial arch up. And you'd be surprised at how much immediate relief people get from this technique. Okay, thank you.